Hi, my name is Erin Rippey.
I'm Rachel Francis.
And we are the current co-chairs of Youth with Vision. Youth with Vision is a student-led organization made up of the Clay, Platte, and Ray counties in Missouri. We are committed to fighting the devastating effects of drug and alcohol in our high schools by turning education into action.
This year we have 4 legislative priorities. 1, keeping the legalization of recreational marijuana off the ballot. 2, banning certain flavors of vapes that are common among youth. 3, implementing a more comprehensive prescription drug monitoring program that will keep prescription drugs out of the wrong hands. And 4, increasing state funding for prevention.
Yes, and while we are sad that we cannot meet with you in person, we have created a couple of videos giving information on the things that Rachel just mentioned. We hope to have your support in the future with some of our prevention efforts. Thank you so much for taking the time to listen to us.
Thank you.
So we are here today to talk about recreational and medical marijuana use. We don't want this spiraling out of control like vaping and many other drugs. Teen marijuana users are 18 times more likely to become dependent on the drug, 7 times likely to attempt suicide, and 8 times more likely to use illicit drugs in their future.
Currently, 10 petitions have been filed in the state of Missouri, but 4 have been approved for circulation. We understand that petition initiatives are out of your hands, but we were wondering what could be our next steps.
Advertising is crucial in how teens perceive medical marijuana. We have to be sure all products are marketed as medicine. For example, on Snapchat the other day, I saw an acquaintance advertising edibles that appeared to be candy. Bright and bold colors and clearly not packaged as your typical medicine. When legislation regarding regulation comes up, we would like to ask for your support for strictly medically marketing.
You can help us by reaching out to us and giving us ideas to help support and keeping recreational marijuana off the ballot.
We would like to bring up the issue of vaping. For the first time in history, more kids are reporting vaping in the past 30 days than they are drinking alcohol. This is a really big problem in our middle schools and high schools, and without proper action, it's just going to get worse. National data shows that 95% of smokers and tobacco users started before they were of the age of 21.
And since February 18th of 2020, 68 deaths have occurred and over 2,000 teens have been hospitalized due to vaping. And the number one reason why most youth say that they start vaping is for the flavors, and there are currently 15,000 plus different flavors on the market still available.
And while we have passed a ban on flavors, the current policy and restrictions only cover some of the vapes. Flavors are only restricted to contain pre-filled packed products, and the ban does not cover disposable vapes or e-juices, leaving countless flavors still available to teens. While this policy has made great strides to preventing youth vaping, as the ban still leaves room for many loopholes that teens can exploit for vaping.
I am a junior in high school, and I have seen a decrease in the vapes being used in my school since Tobacco 21, and I see less amount of kids vaping now than I have in the past couple of years. Although that T21 has helped, they are coming out with puff bars and disposable products, which I think we need to put a stop to.
In addition to puff bars, methanol flavoring is still available for sale in pre-filled formats, and 50% of youth who smoke cigarettes started with menthol. Menthol flavoring is not currently banned under the current flavor ban.
In middle school as an 8th grader, I see kids in my grade younger vaping daily. It's become a recurring problem that the school doesn't know how to handle. They've had to take the doors off of our bathrooms, but even with that, kids still find their way around vaping in school. Kids in class will take their vapes and they'll blow the smoke into the backpacks and then they'll zip it up. There's been an increase in THC and menthol pods recently, which is a problem because menthol causes seizures, comas, and deaths, especially in youths. We hope to have your support in the efforts in supporting Tobacco 21's foundation.
We're here to talk about the budget in regards to prevention. Personally, I have a cousin who has had issues in the past with anxiety and depression. Because she couldn't combat these challenges as a child, this has pushed her to go to illegal marijuana. This could have all been prevented if she would have had those preventative measures in the beginning. She unfortunately did not have the funding for this.
We're attempting to treat the symptoms of these diseases, but we haven't yet cured the root problems of these diseases, which is alcoholism and drug use. 2 cents of every dollar meant for preventative measures actually goes to preventive measures, and 98 cents of every dollar goes towards repercussions of drug use.
To cure the root problem, so to speak, we are asking for your continued funding for what are called Certified Community Behavioral Health Centers. The purpose of these is to provide an alternative for those who can't afford hospital bills and keep them from turning to substance abuse as a solution. They also work closely with schools for prevention and also for mental health awareness. When you spend $1 on this type of prevention, you save $17 to $30 down the road in social costs. In the already established institutions, it has saved $10 million annually from this prevention.
So legislators, today, to further on talking about what Isabella had mentioned, I want to give some statistics. So there has been a total of $20 million, $10 million a year that go towards revenue, and we are asking that you increase the funding towards these mental health programs, and that they will alleviate some of the mental health issues that we have in the state of Missouri today, and we ask that you support us in this ask. Thank you very much.
Hi, I'm Natalie, and we're here to talk to you about the Prescription Drug Monitoring Program. This program allows medical professionals to check over what prescriptions are being prescribed to patients and why. This is through a database that gives doctors access to check over what their recent medical history is to prescribe medicine so they don't have too much.
Hi, I'm Haven, and a PDNP would significantly reduce abuse, addiction, and the diversion of prescription drugs. In Missouri, the death toll related to overdoses of prescription drugs is 2% higher than the national average, and implementing a PDNP would help to decrease these numbers.
Hi, I'm Domi.
Hi, I'm Mally.
And at our school, personally, one of our peers overdosed on alprazolam, which is Xanax. He was easily able to access this, which is a very common problem in today's youth.
A PDNP would make Xanax and other drugs less accessible, so the death rate due to opioid abuse would go down significantly.
Hi, I'm Sophia, and one of the most prominent concerns about the PDNP bill is protecting patient privacy. The PDNP bill would put in place a database that would house patient records and their medical history. This database would only be accessible to doctors and patients and medical professionals treating them. Law enforcement would not be able to access this without a subpoena, which would actually give you more privacy rights than the current law. Since Missouri is one of the only states that does not have a narcotics control program, we have the advantage to learn from the other 49 states.
Hi, I'm Adele, and currently Representative Ryder Bill 1693 and Senator Luke Meyer's Senate Bill 677 both aim to establish a narcotics control monitoring program, a cohesive, unified program between pharmacies in Missouri. We are the only state without a prescription drug monitoring program, and in states that have implemented such a program, we've seen a significant decrease in the number of patients going to different prescribers for the same drug in a short amount of time. For example, New York saw a 75% decrease in this. We are counting on you to support these bills in the House and Senate, aiming to establish a PDNP.
Thank you so much for taking time to listen to us today, and thank you for your continuous support over the years.
Thank you.
Thank you.